Abnormal fat deposit around the thigh area and the lower body concerns a lot of women, and I see them regularly in my practice. They come for various reasons. Some come for shape, some come for discomfort, and some have been battling this since years and they don't know a way out. So what is lipedema and what is lipodystrophy of the lower body and how it can be treated? This I will be telling you in this video. I am Dr. Shilpi Bhadani. I'm a plastic and aesthetic surgeon at SB Aesthetics, Gurugram, India. And I'm here to clear your doubts about lower body fat and fat removal today. Lower body fat is mainly due to genetic predisposition that you have a certain distribution in your body. So many women you will see are heavier on the lower body and some are lean. But what causes this distribution? This is basically what is genetic predisposition, and you are genetically predisposed to have a certain amount of fat on a certain part of your body. It is not only the lower body but also the upper body. Some women are generally heavier on the saddlebags, and you will see that out of proportion increase in the saddlebag. When they wear tight clothing, it is abnormally jutting out, and many a times they want a solution for it. And they exercise a lot, they do diet, but the size changes, the proportion remains the same, and it still remains jutting out of the body, making the shape look not so pleasing. So what is the solution? The solution is a simple procedure which is liposuction, and it is done by a minimally invasive technique. We enter with small holes inside under the buttock crease, and from there we insert our cannula and suck out this fat. But when this increased fat deposit is of abnormal proportion, then it becomes a lipodystrophy, which should be treated for better posture, for better movement. And a lot of times patients come with inner thigh excess fat and they have chafing when they walk. This causes rashes, this causes fungal infection, issues with sweat, and in general daily problems with movement. So of course liposuction is a solution, but what all areas can be treated together? So when I see the lower body area, I see it as a whole. It is not in parts, and the overall look or overall deposit is coming from the flanks, the outer thighs, the hips, the buttocks, and sometimes even extending to the posterior thighs. So all this area can be treated in one session of liposuction. Although these are multiple areas, but if we are dealing with lower body fat, then we can start around this area, which will create the maximum impact in bettering the contour. So let's talk about what all areas are included in typical lower body fat removal surgeries. In the lower body, we start with the flanks, the hips, the butts, the entire thighs can be included. Sometimes even knees and calves are included. But because it's a large area, it cannot be done together, and you must, for your safety, plan this out with your surgeon in stages. And that is why when I see an entire lower body makeover, I divide it into two parts. In the first part, we deal with the area that bothers you the most, which is often the hips area and the outer thigh area, also the inner thigh. These areas can be done together. And along with it, if you desire, you can include the calf with it. So why we should do the calf first? Because the calf is the area which is most dependent. And once you get a liposuction done, it is definitely going to swell up in the post-operative period. So if you're doing thigh also along with it, the calf swelling to reduce will take a long time. And that is why I prefer doing calf surgeries, calf liposuction before I do the thigh liposuction. In the second stage, you can plan your entire thigh liposuction. Sometimes the lipodystrophy is so huge that after you've had the fat removal done, you'll have sagging of the skin. And this can be treated with a thigh lift surgery. So lower body fat is not a simple topic. There is the problem of lipedema, which is abnormal fat deposit everywhere under the skin, not only in chunks but all throughout lower body, even sometimes the upper body is involved. So when we are dealing with lipedema, it is more a generalized condition where most of your body is involved in that. But when we are dealing with lower body lipodystrophy, it is mainly the areas that I mentioned beforehand, those are involved. So when you are planning your lower body makeover, it can be definitely safely planned in stages. But yes, if the areas of concern are few, then you can get your body makeover, lower body makeover done in one session, and that too safely. So remember that we have a lot of videos on liposuction, on different areas liposuction on our channel, and I've been making videos for more than 8 years now for you, and you can go and look into, even the older videos would have a lot of information. Go and look into them. What area liposuction would you like to do? Comment in the comment box below, and my team is there to help you. Reach us via our phone numbers and send your details to us, and my team is eagerly waiting to help you. Thank you for watching, and do share this video with somebody who is struggling for years with lower body fat. The solution is simple and it's safe. Thank you.